My name's Helen Powell and I'm a paediatric specialist physio in Newtown. Jeremy Patterson came to join me paediatric physio session in Cadarren School. We've had 4 kids today, all with various different conditions and diagnoses, so it's using the pool to work on their physiotherapy treatment goals, such as strength and balance.
I've been on another Trading Places day. I spent time in Newtown and Welshpool with teams from the Health Board. I found it really inspiring to see how they could get the children to exercise in the pool environment, but most importantly I think how the children actually enjoyed it. One of the children had communication difficulties, but despite that you could see how they relaxed and how they felt, really fulfilled.
You always have an expectation of what somebody does. It doesn't matter what your background is or what job you do, and so to actually come and have a look firsthand on what we do and how we need to be creative when we work with children, and how we definitely need to think outside the box when we work with children that don't speak and have got very little cognitive level. How do we get the best out of them? And I hope that was demonstrated today, that it doesn't matter what cognitive ability or functional ability, we can still work on goals for them and get them to be the best they can be.
After we'd spent some time at the pool, we went down to the Health Board's Children's Centre in Newtown at Ennisplunt. We discussed ideas we have around trying to rationalise property in Newtown, and if those ideas come to fruition, I think bringing together children's teams in Newtown will be at top of the list of priorities. Well, after Ennisplunt, we went to the hospital in Newtown, and we spent lunchtime discussing things with the physiotherapy team there, seeing how they both look at community-based issues, but also people who come into the hospital. After lunch, we went up to Welshpool. We had a session with Helen Hathaway. It's a new role. Helen looks at both reablement and treatment and the physio side of people with respiratory illnesses.
So we've been out in the community, myself and Jeremy, seeing 2 respiratory patients in North Powys, both chronic conditions, really complex patients with multiple health needs.
The one that was meant to be in, once you've opened it, you don't
Looking at them from health side of things, from a social side of things, and how we can best support them really. So seeing how we can improve communication and improve operations between health and social care, which is always helpful, and if we can improve that, then we can improve care really for the patients involved.
I got a lot out of it. I hope that the people I met got a lot out of it. I also enjoyed meeting the service users as well. But every time when you talk to frontline staff, you talk to the managers and you talk to service users, you get an insight into what works well, but also frustrations in the system. And sometimes these are really small things which are quite easy to fix, but until they get brought to my attention or to Carol's attention as Chief Executive of the Health Board, they just carry on, and it's up to us to try and sort of bring some focus on these issues to see how we can improve it. A major benefit for myself, and I think Carol as well, is that we are Chief Executives of 2 large and complex organisations, and often it's very insightful to get on the front line and talk to staff in your own organisation and to service users, but being able to do that in another organisation, but also an organisation which we work with and we have common service users most of the time, it is really valuable, it's really useful. And for staff and service users to see both of us, see us as 2 organisations trying to work as one, trying to develop, I think sends a really powerful message. But most importantly, it's myself and others getting this feedback so that we are aware of the issues that we can seek to address by improving working together, improving integration, and ultimately this is about improving the service we deliver to the public.